Welcome to Harvard University's Wellness Collective. We are excited this afternoon to have as our guest expert Dr. Patrice A. Harris, a psychiatrist and the immediate past president of the American Medical Association. And she was the first African American woman to hold this position. We are so excited to have you. We just shared a few moments with President Rain Frederick, Dr. Rain Frederick, and we're just excited to have you. And the stage is yours, Dr. Harris.
Well, thank you, Dean Richardson. What an honor to be with you here today. And yes, what an honor it was to share those moments with the president doctor. I am so glad that you all are elevating and continuing to elevate the issues around mental health. I think all of us realize that for many years we weren't so eager to talk about mental health in our communities, in Black and Brown communities. So to do so. So I have a jam-packed presentation. I'm just going to really hit the high notes. We may or may not have a few minutes for questions, but I certainly want to. Maybe I won't have any time for questions, so I can ensure that I get invited back. But thank you so much for having me today. And so I do have some slides, and I'll have my team bring up the slides. And again, wish we were meeting in person and under better circumstances, but clearly we do have this virtual environment because we know that everyone has experienced hardships and loss in the past year, and this is true whether or not you are a physician or a nurse on the front lines, or whether you are a college or university student or a high school student coping with the challenges of remote learning. Some of us have lost loved ones. Many of us have been isolated, some for longer periods than others, and certainly all of our lives have been disrupted. And so in my talk today, I want to explore some of the significant mental health aspects of what we have experienced, and also to provide some tools, but I'll widen it a bit and talk more broadly about the impact of trauma and stress on all of us. I may use the term patients, but at some point of another, all of us are going to be on patients, but really it's all of us, including myself, on communities and on the health system. We know that just like COVID does not impact everyone the same way, trauma does not impact everyone the same way. And certainly as a community of color, and particularly African Americans, as we're thinking about police brutality, we are seeing the intersection there of trauma and its impact on the individual and on the community. And again, we've seen COVID-19. That's the reason why we need to talk more and fight more for health equity. Health inequities are not new, and I'm sure this folks at the Howard community know this. But in this time of COVID, where folks didn't have all the normal distractions of life, we were not able to look away, and so now we have a wider group of individuals who appreciate equity and also appreciate the importance of understanding police brutality. And then we've seen COVID disproportionately impact Black and Brown communities. So I have this slide. This is about me, and Dean Richardson gave an appropriately short introduction. But really, I want you to put yourself where you see my photo, because I need to remind you all and me, I have to do this every day, that in the midst of all that's going on, we certainly need to make sure that we practice self-care, because we are in times of extreme stress, and we are a nation confronting multiple crises simultaneously: the pandemic, joblessness, unemployment, pandemic fatigue. Many of us are experiencing symptoms of anxiety and depression. We all know that we are living in a time of severe political polarization. Our democracy, there was an assault on our democracy. And so all of this has impacted our nation's ability to have our normal foundation and background of even our normal coping skills. And now although there is guarded optimism and we should be optimistic around COVID, we still need to address the new strains. And of course, all of this layered within systemic racism and social injustices that have always been a part of the American experience for many of us in Black and Brown communities. And then we've had those structural determinants of health and structural systems which impact housing, healthcare, education, and employment. I think it is important to just put a fine point on trauma. Again, trauma has long been an interest of mine, and I'd love to come to campus one day and talk. I'm a child and adolescent psychiatrist, and certainly we need to make sure that we are continuing to elevate the issue of trauma. Again, COVID-19 has been traumatic. Many folks have lost friends and family due to COVID-19. And, sometimes we only think about those who have lost loved ones, but as a physician and as a psychiatrist, I think, we are now, it is clear that there's long haul COVID, as they call it, longer term symptoms, both those symptoms where people are short of breath or headache, but also what I call the neuropsychiatric symptoms. So, those symptoms and the effects and the impact on the people and the families will be even longer lasting. And so we also know that trauma, if you think about some of the issues around Breonna Taylor and George Floyd, it is not only the folks who directly experience the trauma that are impacted. I will tell you that many of my African American physician women colleagues could not, and by the way, I have not been able to watch the George Floyd tape. I am not a parent, but many of my colleagues who were parents said they just could not. It was just too traumatizing. For me, and I live here in Atlanta, Georgia, seeing the murder of Ahmaud Arbery it was closer to me, right? And that was particularly traumatizing. So all of these events that we are feeling are all experiencing certainly can lead to trauma. And so how do we cope? Now, there are the externalities of advocacy and changing many of the issues, and I'll talk a little bit about this more, at least what the AMA is doing regarding some of these externalities. But again, individually, we have to make sure that we, again, allow ourselves the grace and the space to feel whatever we are feeling. There is no time to beat ourselves up or to think that there's something wrong with us when we are experiencing normal reactions to the situation that we are in today. So that's the first thing. We have to give ourselves that grace and space. And again, and sometimes we don't always do this. I was talking to some folks today and yesterday, and they were talking about myths around Black men and Black women. The strong Black man and Black men don't show emotions, and the strong Black woman. And sometimes we take on these myths and don't allow ourselves to struggle and don't allow ourselves to, ask for the help and the support that we need. And I'm just going to tell you that I've been guilty of that over the course of my long career because I wanted to be that strong Black woman. And so I want us to sort of think about these things differently and make sure there's no shame in asking for help or support, no stigma involved in that. We should be able to, and you should find folks where you are safe in communicating your experience. You have to remember, not everyone has the capacity to make sure you are safe in communicating your experience. So that's a piece of the work there hopefully are, I know this about Howard, I know there are campus initiatives to support students, faculty, and staff. And there might be external groups. We have to make sure, though, and I will say this, not everyone who advertises in the old days, I'm old, hangs a shingle, say that they have expertise, has expertise. And so I'm sure the folks that are associated with Howard have the requisite science and background and credentials. But I was reading an article yesterday about the numerous apps, mental health apps that are coming on board. Now, listen, I am excited about technology as a psychiatrist, as a physician, even in the broader community. There's so much opportunity for us to use technology, but we have to make sure that there's data and science and credentials around this technology because we want folks to get the care and support that they need. Certainly, I would urge everyone, and I will tell you and admit that I've gained the COVID-20, but do try to, where you can, move. We are today. Maybe some of you are walking the treadmill while you are listening to me. Maybe some of you are on a phone and you are listening to me as you walk around your neighborhood. Always remembering, though, not everyone has safe spaces to walk, but try to get some physical activity, try to get the sleep that you need, connect with others. This has been so isolating. We are virtually connecting. If we certainly all of our routines are disrupted, and so there's an opportunity to establish new routines. And those of you who are parents, engage your children in establishing the new routines. All right, yeah, there are certain things that we cannot do, but here are the things we can do, and let's develop new routines. And certainly right now, if you can avoid it, and this is always in times of great stress, it's if you can avoid sort of making major life decisions, you can do so. We don't always have the luxury of that, but again, in times of stress, you want to make sure that you have those around you. And I always talk about my sister circle, my circle of support, your personal board of directors. Make sure you have folks around you, by the way, who will, first of all, be honest with you. None of us need folks who are just going to agree with everything that we say and not call us out when we need to be called out, but establish that group around you. Again, remember that stress or some of these feelings can be an opportunity to action, right? When you're feeling these feelings, they're a signal in our bodies that something is not right, something is bothering us, and so then that means that we can get to some action, and that's moving and new support. And sometimes you have to focus on the task rather than the emotion, but and that's when the emotion is overwhelming you. But again, I want to get back to everyone and make sure that you know that there is no wrong emotion. You should feel how you are feeling, but the key is then challenge that feeling into action. Again, I talked about building relationships and networks, adding to those that you already may have. One of the projects that the American Medical Association has is regarding African Americans and heart disease, and with a particular emphasis on women. And we talk about a squad, so finding your own squad who will call you up and say, have you checked your blood pressure today? And did you get your exercise today? And, what did you have too much fat, in your diet today? And so these are the things that we can do to sort of channel this stress into action. Now, sometimes our squad is not enough, and we do need to seek professional help. And again, I want to get back to that. There is no shame in seeking help from a professional. I will admit to you that as far as psychiatrists and psychologists are concerned, I know most about psychiatrists. We are not diverse. Actually, this goes for even the broader profession of physicians. And thank God for Howard. We don't have, the number of psychiatrists that I would like to have from communities of color, but that is something we are working on. And certainly, again, technology can help, but we have to make sure that there's science and data and integrity beyond and behind that technology. Now, again, I want to just focus just a moment here on trauma, because again, COVID-19 is the current backdrop against what we are experiencing now, and we certainly can see the impact of centuries of inequities, not new. And so we certainly have to continue to call out that these inequities are well studied and documented. They're produced, not random. And we have to go upstream to structural and systemic racism. We have to have those conversations, and we have to have those conversations around the of trauma and mental health and health care and racism. And we should continue to elevate those points. But I like to start with a slide that I like to show mostly to non-medical audiences about what creates health. Because clearly, health is not just whether or not you have access to affordable, meaningful coverage, although that's necessary, not just whether or not you have access, and hopefully everyone has a relationship with a physician, necessary. You don't live in a medical desert, necessary, but not sufficient. If we really want to be about the business of improving health and health outcomes in this country, we have to address this from this broad spectrum here. And we have to look at, those upstream determinants. And again, if you look upstream and you pull the through line to the inequities we see today, it is about policies, right? It's about those history of redlining policies, some laws, the laws that have been discriminatory, and certainly issues around structural and systemic racism. And we also have to look again at the availability of jobs that pay a living wage, ability to get a quality education. And so many people don't pull the through line between redlining and education. How do we finance our local public health systems? Through property taxes and past history of discriminatory lending. How about building interstate highways straight through communities of color, which means that communities of color, those who continue to still live in those areas, have poor air quality, right? We all know what happened with water quality. So these are all the issues and the through line between racism and trauma and health and education and transportation that we have to certainly think about. This is a lot. I like this slide a lot. I'm working with some folks here in Atlanta, and we talk about the importance of inverting the burden of navigation away from individual and onto the system. And that's really, when we talk about these issues, we have to talk about them as systemic issues. And that cartoon in the middle really just hits home. I'm sure, I bet everyone has seen that cartoon, but I show it every time because, for many years I heard, many of you may have heard, well, we just treat everyone the same, right? But that's not what we need to do. We need to give people what they need. Each community, each individual has their own unique needs, and we should be about the business of giving them whatever they need. At the AMA, we define health equity as equitable opportunities to achieve optimal health. And so that's it. That little kid, his equitable opportunity was 2 boxes. And so we certainly need to have those conversations. And we cannot have a conversation around trauma and health without talking about police brutality. I hope that you've seen the AMA, and this was last year. I was president at the time. I'm now immediate past and the chair of the board at the time. We recognize that, and I remember a reporter asked me, why is the AMA talking about police brutality? We were talking about police brutality. This was before George Floyd, because we recognize that physical or verbal violence between law enforcement and the public, particularly among Black and Brown communities, is a critical determinant of health. So there is a through line there. As we think about the impact of adverse childhood experiences and trauma. We see the impact on not just mental health, but cardiovascular health, cancer, diabetes. And so we really, and as a child psychiatrist, I am keenly interested and involved in appreciating the impact of childhood trauma, clearly. But of course, trauma, I wish trauma didn't exist, but trauma is not limited to children. So we have to have a national conversation about trauma. And then again, that through line and the intersection with mental health. And we're seeing inequities when it comes to children's mental health, not being able to get the care that they need. I've already mentioned the lack of diverse mental health professionals, oftentimes ending care earlier, I think because the workforce does not always appreciate these unique needs. And so that's something that we need to continue to talk about. And when we talk about children, clearly COVID-19 has had an impact on our children. And so I was seeing increase in the number of anxiety. We see increase in the number of Black youth, particularly African American men, who are thinking about suicide and dying by suicide. And so these are all clearly conversations that we have to have in addressing mental health inequities. SAMHSA just put out a brief on, again, the intersection of COVID, which disproportionately impacted Black and Brown communities, and mental health inequities. And so as we have the conversation, and we should be preparing right now, as I've told many folks, we don't have a good mental health infrastructure in this country, and we cannot wait. We need to be preparing right now, just as we were not prepared for this pandemic. We should not use lack of preparedness as an excuse for meeting the mental health needs of our country as we move forward. And so again, at the AMA, we are doing what we encourage, and I encourage all organizations to do. There's an inside play and there's an outside play. There's an internal role and an internal role. And so last June, the AMA did pledge action on racism, and then we followed that up at our most recent policy meeting with passing new policy on health equity. And so it is about naming it and identifying it. It is about policy, but it is about action. Now, let me also say that the AMA has its own history. I'm sure many in the audience know for many years the AMA did not allow Black physicians to join. And we are reckoning, and that's an ING because it's a journey and not a destination with that. We established in 2019 a Center for Health Equity. I'm going to talk about that for a moment, but I don't want to gloss over recent events with our journal, our JAMA. It was a JAMA is network, or many journals, but we had a JAMA podcast where two folks, one employed by the AMA, said structural racism did not exist. I hope you've seen the action on that, and we are continuing to act on that. But in the midst of that, that again, we have launched our new Center for Health Equity, and we have hired our first Chief Health Equity Officer, Dr. Aletha Maybank, and she's doing a lot of work. We continue to fight for everyone to have access to affordable, meaningful health care. The AMA supported the Affordable Care Act, and we do believe that the best path forward is to build upon the success, build upon the progress of the Affordable Care Act. We are all awaiting the Supreme Court decision, but the AMA is, I could spend 2 hours talking about our AMA Litigation Center and all the cases we are involved in. I know the folks in this audience know that the tobacco industry marketed menthol cigarettes to the Black community. And why? To make the menthol cigarettes easier to smoke. Tobacco is the leading cause of preventable death in this country. And so we have been in court and fighting that litigation and advancing legislation on moving all flavors from tobacco as well as vaping, because that's a huge issue, and I'm quite worried about vaping and its impact on the brain. We're working really hard to integrate mental health And so we've gone a long way in making sure that we are elevating the fact that Black and brown communities have been hit the hardest by the pandemic. Early on, we said, HHS, you need to, CDC, state, local public health officials, you need to make sure that you have the data that we need to address these issues. And again, make sure that we are thinking about the structural inequities and the social determinants of health as we go through. We're getting to vaccines, and that's good. I think we all know that we've had to do a lot of work, appropriate work, as I've said. It was appropriate and understandable for Black and brown communities to have questions. By the way, I want all of my patients to have questions. We should be asking questions about any alternative. And so we've done better in getting vaccine acceptance, but now it's about vaccine access. And so we continue to need to work on that. And I know that the folks there at Howard have done a lot to make sure that we are getting equitable access to vaccines, and we are talking to our communities, getting their questions answered. And the AMA was proud to participate in the Ad Council's campaign on vaccines. And so I gave my final presidential address last June, and I talked about the importance of the words of King T'Challa. And he told us that in times of crisis, the wise build bridges while the foolish builds barriers. So we will go forward with that. But I don't know about you, but I was moved by Amanda Gorman at President Biden's inauguration. And it is very hard, and with all of these crises that we are facing, I will tell you, and I still do have my days and my moments where it seems overwhelming. But Ms. Gorman says that while we once asked how could we possibly prevail over catastrophe, she says we should assert, and now we do assert, that how could catastrophe possibly prevail over us. So thank you so much for the opportunity to spend this time with you, and I look forward to an opportunity to get to come to campus and talk more.
Harris, what a very informative, very powerful presentation. And we are looking forward to your next visit to Howard University. And you just have a minute. Could you share what you feel has been the most challenging aspect of this crisis, particularly for African Americans?
I think it's the misinformation and disinformation, right? That is out there, and I think that for communities of color, particularly African Americans, I've been very worried about that, right? The amount of disinformation that's out there. I mean, we support the questions, but it's the disinformation that's out there. And I remember, and I said, and this was appropriate, but the first couple of weeks of the pandemic, not as AMA president, but just as a family member, there was, Black people don't have to worry about COVID-19, right? That's the question that I would get, right? We are immune. We can't get it. And so I spent the first 4 weeks or so saying, we are quite, anyone can become infected. And then as we saw it unfold, it certainly disproportionately affected Black and brown communities.
Thank you so much.
But I will say, and the lack of the foundation of the lack of intentionality regarding these health inequities. So we came into COVID with that, and that made it so much more difficult to get our communities. The testing, I was so frustrated early on with the lack of access to testing, particularly in the Black and brown communities that need it the most. So that was quite frustrating. And then the misinformation and the disinformation.
Wow. Unfortunately, we are out of time, but again, we're looking forward to your next visit.
Very good. Thank you.
Take care.
Thank you. Bye-bye.
Bye-bye.